Hey, well, let's let's go ahead and start. I suspect some more people will be joining us. I knew we were going to have a slightly smaller group this morning, but we just have to sort of meet when we can. Um, in terms of what Hal and I would like to do today is, I thought we would briefly go through our SWOT analysis that we presented. You all have seen a copy of it already. I think the comments from the leadership team were helpful, and it may guide us a little bit farther. Um, then what I'd like to do after that is, as a next step, we sort of need to refine and get 3 or 4 ideas out. And I guess, Annie, that's due April. Um,
Sorry, April 26th, so it's a Friday.
okay, making me nervous now.
Sorry.
That's fine.
You'll probably have the weekend.
Okay, thanks. Um, and then I'll show you some of the ideas from the other groups, because I think that that's what might be helpful. I just summarized them. Some of them didn't give specific ideas, but pointed really more to the weaknesses, which I assume that was going to be a clue in terms of where they were going to go. Um, and then I think we need to have a more in-depth conversation about where we propose to go from here. And that's sort of the agenda today. We have 90 minutes, and certainly can use it all or not. But so let's look at our. Let me just see if I can share my screen a little bit. And can you see that? Okay, good. So this is what we submitted. Mohammed, I'm sorry for misspelling your name, but we'll make sure it gets done right the next time. And I'm not going to go through it in great detail. Rather, I think it's more helpful, since hopefully you've all read it. Obviously, it's a summary of our final discussion, and then I have to really give a lot of credit to Hal for fleshing out that sort of broad conversation we had just before submission, for, I think, capturing most of our comments. So what I'd like to do today is get a sense from you all if we missed anything, and number two, review the comments from the co-chairs. I guess that's what they are. The co-chairs, I think, right? Yeah. So let's just go through. As you know, Shadi Sandvik is providing overall leadership here. And she rightfully pointed out that state support for biomedical research does lag in New York. I think that's something we're all very much familiar with. And if anybody does know specific references to how to demonstrate that, we'd love to get that. I think that would be very helpful, because that will it's a point, as you see, that really crosses all almost all the reports.
I actually added some references there to the online version. I don't know if that shows up. It's the one that you linked to. It looks like it doesn't show up here, but it does for me.
Yeah,
So interesting.
It may not, but if you have it, send it.
Yeah, I'll send them, because I actually polled colleagues in other states yesterday when I saw that comment, and I got a lot of useful information on what other states have. Yeah.
Thanks much, Mira. So just going on, we laid out the SWOT analysis, and there's been, not only our group, but other groups have identified that there are system-wide biobank resources. Shadi specifically says, are they system-wide or campus-based? Let's be frank, these are all campus-based. There's no real system-wide. So I guess she's trying to focus this down a little bit. Dave Amberg from Upstate is one of the co-chairs. He's this SVPR up there. I'm really bullish on using the Department of Health. I think that particularly the Wadsworth Center, has got new leadership, and they're very, they are very entrepreneurial, which I think fits in with a lot with our group. Unfortunately, surveillance data is a challenge to work with because of the confidentiality issues. But there's other data that they have access to that is not quite so difficult. So I would continue to think that DOH remains a strong potential partner. Not sure if anybody's here from DOH. We've had one representative here intermittently. Shadi probably appropriately lays out that point 2 might be similar to point 1, although I think personalized healthcare remains an important thing to highlight. In terms of weaknesses, Dr. Titus, who I think's in Buffalo, highlights that we should push the point of insufficient infrastructure. I think one of the issues here is, of course, infrastructure, but of course also, and maybe this comes up later, I think, just an ability to collaborate. There's just no infrastructure for that. And then, sorry, just saw Peter had a note. Yeah, and then this is an issue that's come up frequently in our conversations, the lack of postdocs and PhD level scientists. So no great shock here. Shadi highlighted inadequate financial support to sustain critical research centers. But Tina, this is an issue you've raised at Stony Brook, actually, that indeed funding has been pulled back from several sites.
Yeah.
And I think that, it would be helpful to maybe have you, maybe write a phrase or two about that, because we're obviously not going to highlight each pullback, but it sounds like at Stony Brook, there's a particularly compelling example. We'll talk about in a minute other work with the other groups, but cross-campus contracting and collaboration by a lack of a streamlined standardized process. This is a huge issue, at least I've confronted. Working, I think we've talked about, if I work with Albany or Buffalo, I may as well be working with Duke or UC or anybody, because it's the same contracting issue. You have to do the subcontracts. It's a huge burden. Like Shadi says, this is one of the biggest obstacles. She's right, actually. Emerging networks as a threat, emerging networks with intercampus synergy and commercialization support. David Amberg says we need a little more explanation of this point. I don't really think we need to, because almost every other group has highlighted this as an issue. I'm joking, really. I mean, I think we probably worthwhile saying that, but you'll see that this has just been an issue almost everywhere for reasons you all are very familiar with. Why do rapid technology advancements pose a threat? Because we're not accessing them. I think that's pretty obvious, but we can certainly highlight that a little bit more. And then this is our sort of summary and proposal. Thought that Hal did a great job in expressing the value proposition. Again, David points out how we align with the priority of another group here in terms of the SUNY-wide research collaborations. And a feeling that, anyway, they're both very strongly feel that this could be a very important issue. And this, again, is this academic industry partnership to improve commercialization, which came up just a moment ago. And at least here we have a lot of our colleagues supporting this. Peter Graschi comes back with this concern that he raised earlier about the lack of postdocs and PhDs, something we're certainly familiar with. And it's a new word for me, but constellation hiring was a priority of another working group too, I assume, and Hal, maybe you can explain this in more detail. It's where you tend to hire in a whole group to try to address a specific issue. So you've read I assume you've all each read the document. Do you have any comments on the comments before we move on?
The last point you made about it was made about adding training, particularly to the physician scientists. This is a bit different than the postdocs. This is targeting clinicians, attendings, and potentially residents. This goes circled back to having protected time. This is one of the biggest challenges that we are facing within Upstate. That they don't simply have protected time, and there is no mechanism moving forward. There's no path. There's no.
Just take some notes here, Mehdi. That's a very good point. You're right. There is a subtle difference. You're absolutely right between the postdoc PhDs and the physician scientists. That's correct.
So Jack, just along that line, remember we've talked extensively about training and mentoring structure for junior faculty, and this falls off what Mehdi just said. I think a distinction between postdocs versus junior faculty, not only in terms of being competitive for generating grants, but also in terms of career development and mentoring.
Right.
Yeah, if I can jump in on that, there is no doubt that when we take a look at physicians and physician scientists, the whole paradigm is changing. There are fewer physicians being trained for more jobs. And so what is happening is there's an economic competition for all of those physicians. The salaries are absolutely insane. And people who are just graduating as a junior physician, they're making $400,000 a year. It's just the competition is out there. So when you're looking at these people who have gone through good training programs, who have done the research, who have gotten involved with the academics, there's this huge dichotomy between the draw of the financial draw, because they're $200,000 in debt, and the desire to continue on in an academic vein, spending their time doing the research work, whether it be clinical or translational or in the lab, and understanding that they're going to get paid $150,000 less against those loans. And when we take a look at that, I think we need to be proposing a different model for those people. I think if you're going ahead and you're committing to taking a vow of relative poverty to what's out there, we need to be finding a way to either offset their loans or to delay their loans or to create some sort of fund where if they're putting in 5 years of research work, that we're helping them along in that 5-year period so that they don't have these mounting loans where all of their compatriots are getting to enjoy their life and they're still faced with loans and or relatively being pulled in 2 different directions at work. So we have to make it attractive. That has to become an attractive position and an attractive thing to do. And I think that we can propose that as a group, not just saying, we need to go back to that old system where we protect their time. It's a financial argument that they're making right now, it's not a time argument as much. At least that's what I'm experiencing.
So you're talking about a variation of like the NIH LRP loan process?
Yeah, and individual institutions are actually doing things. I know, one of my mentees was just given $250,000 by Harvard, as to pay off their loans.
So Jack, and Hall, you probably Hall might not know. At Downstate we've been running a training and mentoring program for junior faculty, both in these clinician scientists for 19 years now. And I did mention 2 critical things, which is grantsmanship skills development, career development, but we also teach them how to write actually and loan repayment programs. So we have a whole section about how to write, and several of our trainees did go on to secure the these
funding.
loan repayment programs, etc. But I think the big picture really is having also a retention plan. I think once you have this training and mentoring team that it's in place, they will make a decision on which clinicians to invest in a way that we ensure that they will continue in that clinical path. Because as we all know, not everyone clinicians are interested in research, which is absolutely fine, but there are those that are interested. And I can tell you from my experience at Downstate is there hasn't been that effort, and I personally lost very brilliant clinician scientists to, as you said, to either a pure clinical work or private practice, etc. So the retention plan is really something we can consider. Another important thing related to the salary, which I don't see under funding opportunities, is I think we should include the Department of Veterans Affairs. Almost every university hospital is affiliated with the VA.
Mhm.
And the career development at NIH offers a salary of $100,000, which you have to convince a clinician to accept that after fellowship. The VA does for their equivalent. It's called CDA, Career Development Program. They actually match the physician's salary to what the market is. So this is a game changer, and not everyone knows about that. So I would just add under funding opportunity, Department of Veterans Affairs, and we can brainstorm later on, specific plans, etc.
Good. Okay. Let's, so,
John?
yeah, John, I'm sorry, I miss you.
Yeah, no, just follow up on a couple of the comments. Mohammed's right in terms of the VA support of physician scientists. And I think, somehow getting a program that complements the KOA program, which we've had a number of people through, as well as the VA career development, that then sort of ensures continuous salary support is very, very helpful. I think, the themes about salary differential and protected time, I've been at this for about 40 some years, are sort of similar to what they talked about in 1981 when Weingarten started talking about the vanishing physician scientist. So it's not new, but it is true that right now the thing that is new is the indebtedness of students coming out of medical school. They basically have a mortgage. And I think that, beyond NIH loan repayment programs, which has been very successful, at least in our experience, getting somehow a state-supported program to do that would be good. But I think that when you get all these things in place, there's sort of a generational change that we sort of need to come to grips with, and I think people, in contrast to my peer group, are very concerned about work-life balance. And, what I tell people that are going to be physician scientists is you have to pursue two careers. You have to be a great doctor and you have to be a great scientist. And so you have two full-time careers, and that isn't always compatible with work-life balance. And I think that, we're sort of seeing a generational shift in that. And regardless of what we do from a monetary standpoint, we're going to be up against that. And I don't know what the solution is about it, other than to hopefully imprint people at a young stage of life like ducks.
Bettina in a sec. John, just to your point, I completely agree, but we're not trying to convince everybody.
No.
We just want those people that are coming through the process who've demonstrated either a love or an aptitude. We don't want to extinguish it. And I don't think that we have to solve it in our group. I think it just needs to be an issue that we make sure they push forward and they carry forward. And the people, whether they be psychologists, economists, or philanthropists, or whatever they are going to be, that push forward from the larger group. I think we just want this as one of the points. I don't think our group has the expertise to figure out, the answer to this question. Although if anybody can, Bettina can. So Bettina?
So
I don't think that I'm better at this than anybody else, but to introduce, I think these training programs are great, and Harvard has them, and they have these K training programs and mentoring programs. But the truth of the matter is, even Harvard, 50% of success for K, and another 50% die off after the transition from K to R01, and then even after the R01, another 50% will not renew. This is an NIH problem. This is not a New York State problem. You know, if somebody like me still has to put in for over 2 years a grant where I produced incredibly amounts of it, something is wrong in the system. We can't fix that here. But I do think the university could help encourage clinicians that didn't come through an MD PhD program to become involved in research. And I think there we should do more, because there's a very small elect group of MD PhDs that everybody is trying to get their hands on, but that's not the only body of researchers that we should really try to support. There's a lot of clinicians that in their career become more interested in research, and whether these are clinical trials or device-based trials, or even, you know, other translational research. And there has to be more support for that. If you, for instance, hired at Stony Brook under a clinical salary, you pay an enormous price for transitioning into the tenure track, and it holds you back in your promotion, and you don't really get the same kind of support that somebody would get that is hired upfront on the tenure track. And I think those barriers should be rethought, and we should have more endowed research chair positions where people that are clinicians but want to devote 30% to their research are not penalized. And that's what the system is doing right now, especially the incentivized system. If you are a researcher, you often fall out of the incentivized program. And so, you know, you dwindle around your NIH cap, and that's not attractive. I think it's unrealistic that we pay back loans for medical students. I think it's unrealistic to keep somebody who goes for a $500,000 job in research. If that's what he wants, then that's what that person is going to do. But I do think that there's a lot of mid-level clinicians that if they had more support from the university and from the state, they would become more involved in research. And that's what we want, because they are at the bedside. They can judge what patients need. And I think this kind of translational research needs to be much more supported by the state.
Great. Okay, I think now that's a very important point, Bettina, and we'll try to include that. I think I want to just briefly roll through the other groups to provide a little context, and then we can have a broader conversation about where we go. Now, let me see if I can just find that. Are you able to see that? It says cardiovascular oncology and immune infectious disease at the top?
No, we're still seeing your old screen, I think.
Okay. Just. How about, okay, your screen, sorry, let me just.
No, you're making progress.
I feel like I am. How about that? Does it say cardiovascular oncology and immune infectious disease at the
You're
top?
good. You're good. If you want to make it a little larger.
Yeah, can you?
That is scary. Let me see if I can do that. Does that help?
Yes.
Even larger, or are we okay? Okay, how about that? Okay, so basically I just summarized the 4 groups, or the 8 groups, I'm sorry. And I put ours on top, of course, because we belong on top. And these are the 5 themes that we laid out in our document, which you all have seen already and just saw now. So then let's take a look at the other groups. And as before, some of them did not move forward with specific proposals. Rather, they just highlighted gaps, which I interpreted as a sense in terms of the direction they wanted to go. And we can see to what extent these, support our own thoughts or our additional things that we should be thinking about. So the first group I looked at was the artificial intelligence in medicine and biotechnology. And this is where they highlighted gaps. They focused, since it's artificial intelligence, they focused a lot on data integration and accessibility. Here's this comment that came up in the reviewers of our group, this integration of university and industry startup. Obviously, with artificial intelligence, computational limitations are always an issue. And when you raise artificial intelligence, regulatory and ethical issues are somewhat, well, we all have these issues. They're a little bit more unique and focused there. They were concerned about a lack of a core lab on AI development, again, probably specific to that group. And in terms of workforce development, I think that's something that we've all have just been addressing and addressed throughout there. The second group we looked at was biotechnologies B, which is bioimaging, a lot of Bs, obviously, biomaterials, bioengineering, and biomarkers. Obviously, we've had some conversations about that in our own group. They proposed this constellation hiring in 3 different areas. Hal, do you want to define for us constellation hiring? It's a term that you seem somewhat familiar with.
Yeah, no, I think it really, it's everything that we're talking about. The fact that if you go ahead and you point to postdocs, or you go ahead and you point to people to run core labs, if you run, each one of these represents an issue. And the way to go about identifying it is to try and start at a very basic stage. We've got universities affiliated with us. Are we doing everything we can to be able to encourage the people to go into the fields and obtain the skills where they would be amenable to joining those programs, all the way up to the postdocs, and trying to make sure that they see the areas. If a postdoc has come to Upstate and has said, I'm willing to spend 4 years in this locale, what would make you think that they wouldn't want to spend the next 8 years there? And so trying to make it so that when you look at each level of the issues that we're looking at, and each level of the processes that we're looking at, that New York State take an active interest across the entire constellation and make sure that, that these people are incentivized in any way that they can. It doesn't have to be monetarily. Just nurturing them in that constellation.
Okay, good. So sticking with biomedical technologies, they actually were a little bit more forward about proposals than the previous group. And they, in addition to constellation hiring, not surprisingly, they felt there should be SUNY neuroimaging centers and bioimaging biobank and a consortium for biotech and biomanufacturing, something they call Empire Biotech, to bring together faculty across the system. So again, going to this process of having systemness as opposed to campusness. The other biotechnology group was Biomedical Technologies D, drugs, devices, and delivery systems. And they focused on weaknesses as opposed to actual proposals. I think they were concerned about the fact that there was a major focus on early stages, and it was hard to get to that next stage of commercialization, something that came up, of course, in our own conversation. And in terms of the limitations here, the technologies offices were felt to be too inexperienced, in not enough faculty, not enough funding, and of course, the lack of linkage with biopharma. So they highlighted some of the weaknesses, but and I guess you can get a hint on where they'd be interested in going. It's unclear how what their specific next proposals were. Then there's the core infrastructure working group, which I don't know. You can see here they highlighted a number of weaknesses, none of which we're surprised by, I think they're probably a reasonable approach. The data analysis bioinformatic expertise is something that we clearly saw in the AI piece also, and we've discussed it. Health Disparities and Equities Working Group tended to focus on workforce issues earlier in the pipeline, community colleges and high schools. I'm not sure there's a lot of overlap with us, only that, one key aspect of the workforce is going to be administrative and technical staff. Finally, the other two groups is the Innovation Translational Activities, or the ITA group. They proposed a fellows program with that could help make this translation from bench to bedside to commercialization. They call it the Select Fellows Program. And again, we're hearing this focus on a SUNY-wide economic engine for commercializing. They proposed something called a venture studio, which I didn't go into in great detail, as a way to take more mature biotechnology IP to licensure. So that's certainly a theme that we've dealt with. And the Mind-Brain Working Group, again, focused mostly on some of the gaps. They're sort of a similar group to us in that they're sort of disease-oriented as we are, although our diseases are a little broader. And they focus on the gaps again, need for enhanced visibility. There is relatively strong neuroscience resources across the system, and nobody really knows much about it. There's a technology integration gap, and the lack of integration of core facilities across campuses. Computational approaches become a huge issue, and this issue of multi-omics that we've discussed, as well as imaging and computational data analysis, exists, but there's no really collaboration, and enhanced facilities for computation, something that we've discussed. So those are the 8, including us, and you can see some similarities to what we proposed, and also some areas which are not similar. Probably worth at least reflecting on those, see if anybody has any comments, and particularly if they might provide some guidance for us.
One of the other things that we had talked about as a group a couple of weeks back, that I think also falls in terms of the constellation hiring, is that we had talked about the fact that we couldn't be good at everything. And that, like that looking across the board and trying to just set up platforms and, and leaving it out there. So, within that constellation hiring, I think we also were talking about the fact that focusing in on hiring groups of people to come into institutions that had either an entire group working on a singular project or something that was harmonious or synergistic with what was going on already at that institution that may be identified as a strength or across the entire SUNY platform, something that we'd want to integrate in that way. So as I was watching the other groups, I think they were touching on that a little bit also, getting that area of expertise. Then it becomes more efficient if you already have established relationships within the groups that you're bringing in. You just have to make sure that there really is a cohesive fit.
Any other comments on our colleagues' work?
I think if there is anything that I know, again, we discussed it before, is the fact that the health disparity group really did not say anything about disease and health disparities. So they were mostly focused on
Training.
training. So I don't know if we wanna bring that up a little bit in our terms that we used as that we also will consider the disproportionately the fact that the main disease topics we're interested in disproportionately affect minorities or underrepresented groups. I think that's the word they use these days.
But Mohammed, did you look at their report? I didn't miss anything, did I, in terms of?
I did. I actually looked at all of them, and that was the first thing I saw, that there was really no emphasis on
Right, okay,
on health disparities as an outcome.
right, okay.
Yeah, Mohammed, I think you're absolutely dead on with that, in the sense that that was more futuristic looking, like, let's get people into the pipeline, but what about the people today? What about our ability to impact communities? What about our ability to impact the young scientists that are available out there, or those that are doing work in healthcare disparities? We're not tying that into our imaging programs, our biobanking programs, our omics like we're not pushing ahead. And I think SUNY has a unique opportunity because of the different populations that we serve. I don't think you can come up with a state that has more different populations.
Any other comments on the other groups? Surprised, expected, anything?
You want to go around?
I mean,
the room?
For me, I looked at almost every one of them, and honestly, not to be biased, ours seems more structured. And I like the fact that we had an actual introduction, introduced the topic before we started talking about strengths and weaknesses and all that. And I liked, the Venn diagram, or whatever you want to call that really summarized things. I didn't see it in any of the other programs.
Well, give credit to Hal. He did a great job pulling this thing across the line.
Yeah, I totally agree with Mohammed. It's a fantastic. Our document looks very compact and nice and covers all the topics. And thanks again to both Jack and Hal for a wonderful job. Thank you very much for taking the lead and the leadership. Thank you.
Okay, well,
John, any other comments that you might have?
No, I mean, I thought the way that this group's ideas got put forth was very clear. Some of the other ones are a bit fragmented, and I guess the real key thing is how they're going to tie all these things together into sort of common threads.
John, when you say the other groups were fragmented, are you basing that on just what I said, or did you actually look at them and come with that conclusion also?
No, I just looked at them, and I mean, they said a lot of things that you'd anticipate, but it wasn't. There weren't a lot of big ideas.
I think we also have a unique advantage, though, because we have diseases to shoot at. You know what I mean? And so we can go through the entire process. It's stuff that we have a lot of old stuff to base our structure upon. And it's easy to tell an administrator why they should pay attention to cancer or to cardiovascular disease, and a lay person along the way. It might be a little bit harder to talk about theoretical computing and the like. So, and I think, again, when we take a look at our points 3, 4, and 5, I think those are things that cross everybody else's group. Number 2 seems to be something where we absolutely recognize this deficit across not only the groups, the diseases, and our lives. And then I think, our uniqueness, is in number 1. where we get to drive the biotechnology of our disease states in a way that pushes New York to be a leader or very competitive in those fields. So, Mira, any comments that you guys want to direct, because I like to get it done. And, and we're looking at, a couple of deadlines and trying to move our project towards completion so that we can then troubleshoot it along the way and not be, sliding into home. So does anybody have any thoughts along, how we should be pursuing the next step?
I like the fact that there's a lot of overlap between the sort of solutions that we have identified and what other groups have identified. So I'm wondering if that's something that should be emphasized when putting together the final document, that there are certain themes that come up again and again, and specifically in this case applied to disease related research. But yeah, I think the workforce development and the interaction between campuses and all core facilities, they came up in all of this, and we talked about them a lot. So I feel like those are really strong themes.
Mira, do you think we should be getting very specific, or do you think we should be just giving them our ideas and our needs within that, and then allowing the group to kind of figure out solutions? I mean, what are we as a group? What are we thinking?
Well,
our role is.
How maybe and I'm going to ask Annie to briefly pop in and talk about what the expectation is for this document on April 26th. In other words, it's a 4 or 5 page document, I believe, and do we just flesh out a little bit more what we've done? Are there dollars and cents and specific processes that are expected?
Yeah, so there's in fact 2 bigger deadlines, right? So there's the April 26th with the recommendations. And let me just share my screen. I'm going to kick you off from, I can't kick you off.
But I can what?
Okay.
I'll just do stop share.
Okay, thank you.
Okay.
So yeah, for April 26th, focusing on the second part of the findings and recommendations section. So if you remember, this is the overall strategy document that all the task forces, all the working groups will be using. So you've completed the first 2 bullets here. Let me just zoom in. The first 2 bullets here with the SWOT analysis. And I think you've started on the recommendations, right? To get the initial feedback, which I think is really smart of you, to get, the co-chair and Shadi's feedback initially. So as far as, for April 26th, this is the part that, these questions, these items should be addressing in your work in the next week. And then the next major deadline is the May 12th, which is essentially all the supporting documents. That will be the appendices, the contributors, the bibliography, and then I think there's one more, methodology. Okay, so for the next push, it's really this part.
And is there an expectation on how many quote projects that we might propose? I had the sense, how I've been talking about 4. Is this something we just created ourselves, or did someone actually save it?
Yeah, no, I wouldn't, no, there was no number.
Okay.
Yeah. It's just, whatever ideas come up. It could be 10, it could be 1 or 2.
Is there a benefit talking about the overlap or the interactions between the working groups at this stage?
Yeah, absolutely. In fact, when we meet for our 3rd convening for phase 2, we will be talking a lot about the overlaps and the recurring ideas that we're seeing over and over again. So yes, if you're seeing that as well, because I really appreciate the work that you're all doing, especially Jack, with reviewing all the documents of the other working and seeing, what the common threads are. So yes, I would encourage that.
Does anybody think that there's value? Each one of our groups, the three that combined to make this larger group, each one produced a document. And, when you go back and you take a look at it, it's pretty impressive, what the groups came up with. Do we want to see if we can retrofit any of those ideas within the individual groups back into our document here, like what fits, so we don't have to reduplicate work? Or do we think we've moved on past those initial documents in terms of, what we want to have as a final product?
I think that's a great idea, actually. I mean, our cancer group is still meeting. And we're actually having a discussion, I think, this week about trying to integrate tumor banks. So yeah, I think definitely.
Hal, I think that is a great idea. I will just say, I think, not to beat a dead horse, but the cardiovascular strong as was cancer. I think the infectious disease group was a little less focused, if I can be frank, although I wasn't providing leadership there. So I think we've moved a little bit beyond that particular group.
Yeah, but I think this group on the infectious disease has come up with really good, comments. I mean, we talk about, direct applicability of the work that we're doing to today, tomorrow, and, in 5 years from now. And I don't think that in the inflammation and infection world, I think that is so topical for everything that's going on. So I think that we have we can have a strong proposal coming out of this also. So
I think also the
go ahead.
the intersection between cardioimmunology and cardio-oncology is also an important aspect. Although, again, I know we had these conversations at the beginning, and now the write-up is individual diseases specific. But eventually, I think the intersection or the cross intersection between these pathologies, which is a big, I'm sure I don't have to convince anybody about cardioimmunology aspect. This whole book here it's titled Cardioimmunology, Inflammation, Immunity, and Cardiovascular Disease. So not to mention cardio-oncology, which I don't know too much, but I know it's also a big topic.
Do you notice how cardiology always insists on being the first word in that? It's not immunocardiology or oncocardiology.
It just sounds easier. There is nothing there. Just because cardio something, it's easier. That's it.
So again, next step. Do we want to get more granular? Let's begin with the end in mind, right? That they want a document that they can use to kind of pull together a larger document. So what do we want that document that they pull together to say, and kind of work backwards for it, so that we're not just doing work that will gather dust over the centuries, that work that they can utilize. When I look at that, I think coming up with suggestions in 2, 3, and 4 bullet points of things that we want them to consider, would be a use of our time. But within number 1, actually coming up with some groundbreaking stuff, across our unit, because the charge is, accomplished over the next 3 to 5 years. To have results in 3 to 5 years. So it's all well and fine to say we'd like to create buildings or infrastructures or get postdocs or junior faculty or all that other stuff. But what's going to be the deliverable over 3 to 5 years, in the research world or the biotechnology world, that it's going to make the politicians, people, and clinicians and researchers say, wow, that was worth the $1 billion we asked for. That wasn't rhetorical.
Should we go back to the 4 or 5 ideas that we had, just to now that Annie's gone through this, to do that, and just to so the top is our, you guys see that, right? Okay. Um,
1 and 2, right? The disease accelerator program. How do we go within each one of our fields and say, these are unique strengths to SUNY? And, where do we want the effort put in? This is where we were talking about the omics, the tissue, and et cetera. And then the comprehensive data integration solutions being, how do we go ahead and make this cross SUNY?
The one point I was thinking about in terms of number point 2, and I feel like the AI and medicine group is going to really do a deep dive into that. And is that something that we should just simply support, or should we try to flesh that out also, knowing that they'll probably be there?
I know my opinion, but I'd love to hear everybody else's.
Now, I'm assuming that number 2 does not include the biobanks, right? Biobanking is under the first bullet point, is that right? Even if it has some computational challenges associated with it. So yeah, I guess I would be in favor of maybe consolidating or removing the second point, but that's just my opinion.
Me too. I think if we generate too much redundancy, then too many points, it's better to give them less and make them really do it.
Now, the question I have is, so we're asking for funding in some way, shape, or form that should be applied somehow. So what exactly, so for example, when it comes to workforce, we talked about a number of funding solutions, whether it's loan repayment or providing bonuses or protected time payments or creating some workforce retention programs. So when it comes to disease accelerator or disease solutions, what type of money or funds for what purpose would we be asking for? Is that to support the operation of the biobanks? Is that to provide grants for specific disease targeting research? Or what exactly is the solution here that we are aiming for?
Well, just to go back to Annie, on that document that you shared, there was an interest in having us put the number of dollars on there. Is that true, or are we should we be budgeting this out at this phase?
We do say best estimate. So it's not, there's no need to reach out to or do any online research to vendors or getting bids or quotes, things like that. It's more based on, like how throw out a number, the 1 billion, roughly what does that entail essentially?
I see.
Yeah,
Yeah.
I guess my question
Very
is,
rough.
what's the mechanism even? Not necessarily what's the amount. I guess the amount comes after the mechanism, but what's the mechanism to accelerate this disease research? Is it through targeted grants or through some other ways of using the money?
Well, I mean, I think they're looking for additional support from the state of New York,
Right.
But then how it gets used, it could be. I mean, I think they're looking to us to that.
Yeah, so that's what I'm saying. I'm trying to think like what would I suggest, and I'm not sure. I mean, I would maybe propose a cluster of grants saying, okay, maybe we want to say there should be grant programs for, say, cardio immunology or cardio oncology, because maybe there's not enough funding in that overlapping space, or maybe there's not enough funding that can be used to deal specifically with the diverse populations in New York State. So that's one way. Or is it more like funding to specific core facilities? So I'm just curious what, how people envision that actually being used through what types of programs.
In general, when at least from my word, when we use the term accelerator for any program, is basically to be ahead of conventional programs. And for example, the training, and I'm sorry, I keep coming back to this because it's a program that works, the training and mentoring program that we set up. It basically accelerates the timeline for outcomes, for academic promotion, for publications in those people who are part of it versus those that did not get the opportunity to be part of it. And I think this process, Mira, could apply to everything else we propose. So if we have a good infrastructure, if we have staffing, if we have training and mentoring program in place, together, this will all allow disease acceleration programs that will push the SUNY system at the forefront of what we're trying to achieve. That is my understanding of when I see this word. But
So it's a matrix, right? You know, that's one of the columns, right? You know, we go ahead and we take our 3 diseases and make them the horizontal. And then, you know, we cut through them with these mentoring training programs, with these
infrastructures, availability, biobanks, and
diversity, et cetera.
Diversity, yeah, everything else that we put in place. So that it's basically gonna give us an edge and help us accelerate and move compared to a conventional, you know, problem full kind of systems that we probably have in place right now.
Well, so to put like a figure on this, are we thinking in the range of program project grant, how the NIH funds, you know? Do we say like we want 3 program project grants in each university? That would be a lot of money. Jump started. That is financed for, I don't know, 5 years. And with the expectation that that program project grant then basically gets outside funding from the NIH. That, I think, would be a very realistic way of putting a number on it, you know? So if each university in the 3 specific fields gets the amount equivalent to an NIH program project grant, then they would have to identify PIs, and then they would, you know, generate systems with pilot grants. They would generate systems with, you know, postdocs and graduate students. And then on top of that, I would suggest that we, you know, do a SUNY-wide, you know, what Harvard and what Yale and what all the big Ivy Leagues have, which is a really very successful K funding, you know, like a machinery, where both for Ks for physician scientists as well as for scientists, where, you know, you help postdocs and fellows to transition into an academic career. And I would put a mid-level one in there too. This is all asking for a lot of money, but that's, you know, would fit all of that. And then the only thing we need is extra money for state-of-the-art facilities. And we would have to identify how many facilities per campus should, you know, have access to that kind of money. There I would really try to get true state positions for scientists to run these facilities. That's what's really missing. These are not grant-funded facilities. These facilities, like our hybrid facility, was shut down. It was shut down because they didn't have the salary anymore for the person that ran it. And you can't run a facility like that with postdocs. You have to have a dedicated person. And there are other facilities, lipidomics and, you know, computer-based ones. I think there we should just ask for state positions and for money.
And
Annie, as you're listening to that, and you're thinking about the final document, how much of that detail, you know, is necessary to go into the final document? I mean, is that the direction we should be heading in?
That was a question for Annie.
Yeah, it's really hard to say. I'm also trying to channel the co-chair and Shadi, you know?
Because I think everything Bettina said is dead on in terms
Yeah.
of how we approach it. But are they looking at this as a political document to engender funding to the group and not the specifics of what that actually looks like? Is it the imperative and the direction, or is it the detail, at that, at the how we're going to administrate this that we should be searching for?
No, so I would say probably not all the finer details of administration. But I do think that they're looking for details of how these ideas would work. So if there's a way to find a middle ground to give more substance, right? Because I would not say it's a political document. I would say it's really like a working implementation document.
Okay.
So just following up on Bettina's idea, I can just share with you the experience we had at NYU when we hired the new Dean School of Medicine about 10, 15 years ago. One of the things that I thought was really original that he did is he put in, and I'm talking scale now, so it's a small scale. When it comes to the SUNY system, we have to scale it up. $1 groupify each other in terms of research interest. So immediately, before you know it, you see all kind of groups that start being formed in the system. Why am I talking about this? Is because I'm already thinking about cardiovascular, oncology, immune infectious disease. This could be one proposed mechanism of identifying groups within these thematics, within the system, because we don't know them. And it will be also, once we have an incentive, I said $1 million for NYU, maybe this should be $10 million. And these groups will be tasked to come up with what is their research targets, what are the infrastructure they need in terms of both physical as well as human resources. And I think this will give you an idea about how much money you're going to need, and also propose an actual solution of how to proceed to the next step. Just an idea.
I think Mira's had her hand up for a little bit, so Mira, feel free to.
Yeah, I just wanted to mention, so I really like all the ideas discussed so far. So in terms of how to write it, I was looking at the outline of what we are supposed to put together that you showed previously, and there was something about what do other states do, what are other states doing or other universities doing, and what's happening in industry and how that relates to the challenges that we are trying to solve. So actually, if you look at other states' programs, some of them are similar to what we are discussing, like the Massachusetts one that I think I emailed everyone. I talked to someone who had funding from that program, and she mentioned several aspects of it. One was workforce development, like creating internship positions and other type of funding for workforce development. One was putting together grants that require industry involvement, that stimulate commercialization. So I think if we look at what other states are doing, there's support for all of the bullet points that we have in what is happening in other states, and we can do we just discussed. And also, I think it said something about industry challenges, and I know that workforce development and retention is a big challenge in industry as well. I was just talking to someone who works in a biotech company and was saying that they don't have a good career ladder for retaining and developing their technical staff. So the same issue that we have, we were just talking about core facility staff or retaining technical personnel. So I think if you bring in a little bit of that overlapping challenge into each bullet point and then say how we are trying to solve, maybe that would be that would be a good way to write it. And I think especially the workforce development sounds like we're all on the same page, but there are a lot of different aspects of it, from core facility staff to entry-level technicians, which overlaps a little bit with the diversity group, because that would be someone who might be just coming out of undergraduate education, to clinician scientists.
I think the system mainly needs money. That's my personal opinion. And if I look now, like I applied for a seed grant by New York State and I got it. It's like $40,000. And this was, you know, in order to tie me over and to resubmit my NIH grant. To be honest with you, that's a joke. For $40,000, I can't hire anybody, not a postdoc, nothing. And so this is a very common program of a problem of internally funded grant money. It's just not enough. Pilot grants of $20,000, you can't hire anybody for that. And I think if the state would step up and generate more real grant money, you know, and I love the idea of, you know, forcing people having grants with very specific perspectives, like saying, we're going to put out grants, $500,000, but you have to collaborate with industry and you have to hire so many people. That we could do. Or you write program project grants and you say there have to be people with three, you know, from 3 different departments on there, or there have to be, you know, cardiologists from 3 different campuses on there. That is all great, but the important thing is that these grants are real grants. Science is incredibly expensive. A postdoc costs $60,000 starting with $30,000 fringe. That's $90,000. So these grants that are $75,000, you know, they don't take you anywhere. You need real money in order to develop a program. So rather than asking for all these small chip money, I think it's better to have less programs, but they are properly funded. And I like the idea of coming up with some very specific directions that, you know, fulfill our mission, like, you know, hiring people, you know, could also be diverse, could be across campus, across departments. That's all fine. It has to be real money.
So Bettina, are you suggesting, it's a great idea, but I think it should be another title. I wondered, Jack, whether we can add a bridge fund to support those that already have a grant.
No, it doesn't have to be bridge fund. Can also be new funding. People can competitively, it can be a grant like an NIH grant, but it has to be real money, not this $40,000 stuff.
Yeah, Bettina, as you're describing this, you know, in my head, I'm seeing 2 tables, you know, a table where you're literally listing these positions and then real money necessary to support one of those things. It can't just be there's $40,000 worth of funding. It has to be postdoc has to have a $90,000 price tag associated with it. That, you know, technician, clinical research coordinator, each one of these has to have a price tag associated with it so that they can't get away with an easy, here's 40,000 or here's 60 or here's 100. You know, it has to be what the real costs are that researchers are facing, whether they be clinical, basic, or translational. And I don't think that exists anywhere. You know, it's nebulous. I also
but I mean, that's NIH money. Like, for instance, my salary, 10%, if I go at NIH cap, the overhead in SUNY is so expensive, and the indirect cost, you know, like if I just go on with 10%, it ends up chewing $50,000 of a grant. And the problem is just we don't have enough money to hire. I don't hire technicians because frankly, they're too expensive. Their fringe is 40% versus 28% on a postdoc. And everybody thinks the way I think. And
there's a second thing though, and that's the point that Mehdi brought up, you know, that I think is something that we really don't appreciate. If you have somebody that has, you know, gone through the fires and the tribulation of creating a research career and then gets funded and is able to produce work and is able to support a laboratory or a clinical research outfit, and then all of a sudden loses that funding or doesn't have enough to continue on, you know, now it's an investment of 5, 10, 20 years in a career, and those people are dropping out. and they're walking over to industry, or they're just leaving research completely. And to have invested that much in those groups and people, and then all of a sudden just say, there's nothing there for you, go ahead and find $40,000 and hopefully that'll tide you over to your next $1 million grant. That seems ridiculous also. And to sacrifice all those people, this might be another vehicle. I mean, I'm seeing two different tables, that where we're proposing both of those, and whichever they want to put into the final document, I think this is a unique group to be able to do it because we live that life on a daily basis. We see people to our right and left, investigators dropping out or not being able to fund their labs or having to, to go for, on life support, waiting for the next thing to happen. I mean, the fact that you have to go for a $40,000 grant after all the research funding that you're able to create and all the productivity you're creating, that's not a good use of your time.
So yeah, go ahead. Sorry.
Sorry, I just want to ask a question. So when we're talking about the table, do you mean like a description of the program on the left and the cost of the corresponding program on the right?
Yeah, or get granular in terms of, what a postdoc costs, or what a technician costs, or what a course center, leader and or worker would cost, because these are opaque to everybody else. They're just, it's just a research cost, but you don't understand you need 5 bodies, or you need, 3 levels of support. So I think somebody's got to be talking about it, and I don't see anybody that is.
Yeah, so I think
Tina and Mehdi brought it up.
so for each bullet point, let's say we end up with, say, 4 bullet points instead of 5 that we have right now. You might have 2 or 3 solutions, right? Whether it's pilot grant, bridge grants, program project grants, workforce development mentoring program, or whichever solutions there are. And then on the right, each solution would have a price tag based on what is actually needed to make it useful. Is that kind of how you envision?
Well, I think we have to decide as a group. Are we picking 2 projects and we're gonna push through that, or are we trying to do systemic change? Where this can apply to anybody. It doesn't necessarily have to just apply, to the 2 projects that we choose.
I mean, if we just want to enhance research, if you put out 25 $500,000 grants every year, right, across SUNY, then these are real grants. People, and you make it a mandate that they have to employ a certain set of people on these grants, then these are grants people can work with and can actually then, in 2 or 3 years, develop grant and get more NIH funding in. And you could put a mandate that if you want these grants between 2 PIs or something like that. But I think a grant funding process like that would pull more people into research. You would just have to have...
Yeah, let me follow up on that. But would you suggest that these program project grants require that at least 2 campuses engage in them?
We could do that. You could say we put out $500,000 grants and people can apply, and you want PIs from 2 different campuses. And it can be a disease, translational, or basic. But what I'm asking for is real grants, not these $100,000 grants. This is what everybody is doing. And it's not enough to really build. Research is too expensive.
It was good 25 years ago.
Yes, but it's not good anymore. Not with the current funding. And a $500,000 grant, I think you would get a lot of interest in people applying, and you could have rules. You could say that people that have 3 other R1s cannot apply. You could have rules that, I don't know. I mean, one could really think about trying to support people that may not get funded through the traditional NIH system.
Or that goes through the check boxes of young investigator, or second level investigator or diversity or, a topic of strategic importance. We could create a whole bunch of those downstream things. Joella, anything you want to?
Just a quick question for Betty.
So sorry, go ahead.
Yeah. Bettina, were you thinking 500,000 for the two campuses, which will bring it to 250 each?
Yeah, I mean, that kind of is a problem because then immediately, I guess each person can hire one postdoc. Yeah.
Okay.
But what I'm trying to say, even then R21, like what the NIH puts out, it's ridiculous. You can hire, barely a postdoc for 2 years.
Right.
And that is $275,000. So this should be the minimum that one investigator gets. And even those fundings are, because by the time you find the postdoc and you hire and all that, I just think that that would help the system. If we would put out a whole set of grants that people could apply for, that would get people interested in science and applying. And of course, you have to have a system in there where you really make sure that the people also produce and then go on and develop research.
Maybe a better way to formulate it is a modular NIH grant, which is 250 per site, per PI, and then encourage the participation of as many sites as possible. So it doesn't
That would be good.
Yeah, so that's one way of putting it. Then if it happens to be 2 sites, so be it, and it's going to be 250 per PI per 2 sites. If they can bring in more than 2 sites, then it keeps it open.
I like that. I
like that, yeah.
That it's modular and that you can add to it, because that really does encourage you to reach out to other campuses and integrate them in terms of the work.
And I was just going to say that I totally agree with you guys. Everybody agrees that we need more bigger grants. The problem I see is that how many active researchers are there in the SUNY system? There's going to be incredible competition. There's not going to be enough money put into this really to even make a dent. I'm being a pessimist here, but this is what I'm afraid of. I mean, I know that New York has a very small grant program for cancer, and Doug is actually one of the administrators of that runs the grant program, and they never have enough money. They always have a lot of applications. I don't know how to solve this, but.
But so 10, I just did the math, 250 with 20 PIs. You can divide them anyway.
Plus overhead.
Campuses, yeah, that's 5 million.
Right.
5 million. I thought we're talking billions here. So so a 5 million, I think 20 PIs. I think that's a reasonable, budget.
And if I can add that, I think we've gone down, I won't say a rabbit hole, but we've gotten very specific on one portion of what we think this group is supposed to be about, which is the infrastructural level of what we're trying to create that we think is going to generate ideas and solutions. So I think this is one part of what we're trying to put together, and I don't know if it's 3, 4, or 5, where we're going to fit it in. But then the question becomes, again, with our main charge, the disease accelerator program. How do we really create a disease accelerator program where we are competitive and leading and using New York, the SUNY system as a lever to kind of attack disease states or improve the quality of life of New Yorkers or create high-paying jobs within that sphere? I think we need another meeting to kind of go through this in order to be able to be topical and to give ammunition to Shadi and the group, to what they're fighting for.
Well,
one of the things that I noticed, sorry.
Go ahead. I'm just pointing out that we have about 5 minutes left. Hal just introduced the concept of another meeting. I think I'm very careful with everyone's time. Hal, I feel like you're going to be in the air somewhere for a little while. Do you have a sense on when you might return, or you just
Yeah,
gonna
I'll be back Wednesday, next Wednesday.
a week from Wednesday? Okay. So we certainly could have a follow-up meeting, and Hal and I, but mostly Hal, has an ability to generate these ideas very quickly once we come to some sense of consensus. So we could have another meeting next Wednesday or Thursday to really solid these down, but I want to hear what everyone else thinks. We do have
I'm going to be in the air, and I like the phrase for 11 days starting this weekend.
Okay.
I am proposing $250,000 grants. That's 25 million. That I think will be about 20 grants per campus, and it's not gonna make a huge difference, but it will. That people will apply for.
But
And
Gina, I agree with, I think that should be already in our proposal. I think that, I don't even think that we should be discussing, should it be a little less, a little bit more? I think that's a great number. And I think it's a great number of grants, and even asking for more of them, if you want to go up to 50 million, whatever, kind of works in that. And I think that we should integrate it, and I think we should write it out. I don't think that, because I don't think we're in a position to do the economics for them. I think they'll do the economics. I think they'll kind of create that and figure out what the indirects that we're missing on it, what the support staff that you have to have in order to be able to administrate, et cetera, et cetera. So does everybody agree that this is a worthwhile thing to include in our final proposal? Or does anybody have any objections to it? So let's go ahead and just put that in, and you'll help refine it. And so, like, moving on to the other stuff, how do we want to, before the next meeting, empower the group to kind of come up with ideas so that we don't have to brainstorm it as much at the meeting, that, people can be raising, proposals, and then we kind of, work our way through? Or do you think this way is efficient?
One thing I noticed with Annie's document was that question of things that are system-wide versus campus-centric. So maybe we should start thinking about a grant program will be system-wide. Mentoring and training could be system-wide, but then the omics may be centered wherever those best core facilities are.
yes,
And, then we may have some consortium with the tumor bank or with the tissue banking. So maybe thinking about it in that way might help us get some ideas.
In terms of the process, at this point, would it make sense to have a shared document where people can just jot things down, or would that be too confusing if there are too many different inputs?
I mean, we're not that many people. I think that I like that system-wide, because some things you can make it cheaper by making it system-wide. Like training, you should make system-wide.
Yep.
And I agree. And some facilities, core facilities, should be system-wide. It's better to have one good facility than 5 bad facilities. And the grants, there could be 2. There could be, I like the idea that you encourage collaboration, and they could sort of click them together.
And having people move in between Stony Brook, if they decide that they want to leave Long Island and go to Brooklyn or Buffalo, to be able to show that this process exists cross campus, I think will lead to retention also.
Right, absolutely.
The biggest problem the NIH has, they put all their money in contracts. And we want to avoid that the state does that as well. Because what's the driving machine of research is the individual investigator. That's the person that trains. That's the person that role models. That's the person that mentors. And that pot, that R01 discretionary fund, is not increasing enough. Everything, even when the budget gets bigger in the NIH, they put it all in paying for Moderna vaccine and paying for contracts. So there's a lot of people that make a lot of money from the NIH, but it's not the individual R01 that gets sponsored. And that's why people are so frustrated, because of funding deadlines of 10%. And if we can break that with state grants, I think that will ultimately keep people in research.
Andreas Kalogeropoulos was talking with me yesterday saying, you know, on the contracting and IT and data identification, the NIH is making, just put out a proposal for review that specifically for devices, but it can be extended towards tissue and drugs, that they think is going to simplify that process. It's something we haven't talked about as a group, but I just wanted to drop that at the 11th hour to make people aware of it, because it's something I'm going to kind of try and bring back to the group next time and talk about. Does it address one of our issues also in terms of the way that we're looking at contracting?
So just to close out, I'm not sure we need a specific shared document, but certainly feel free to email either the group or Hal and I as we begin to pull these other ideas together. And Bettina, if you could further develop that, even a paragraph or two, that'd be great. And then Hal and I will figure out a data chat late next week. Is that reasonable, Hal?
Well, do you want to take a poll of the group? I mean, shared document, you know, how comfortable are people with Google Docs and shared documents? How people, you know, and who's really uncomfortable with it and likes sending emails back and forth? I mean, I think that, you know, we have to come to that aha moment, because I think we have a division in the group.
Yeah, I'm a big fan of shared documents, because otherwise you end up writing the same thing, you know,
Yeah,
3 times.
Okay.
And for those of us who are less good at shared documents, this is a wonderful time to evolve.
That would definitely, I definitely fall in that category. Okay. Okay, we'll try to set something up.
Thank you guys for the hour and a half. It really is, you know, we realize that this is one of those where, you know, the amount of RVUs and money that they send you in exchange for this hour and a half has been dramatic. I think, Bettina, they funded 2 postdocs for you. But no, it really is appreciated. And I think that we're going to create something we're going to be proud of. And you know, and hopefully it's going to move the needle. And I think we're in a unique position. When I look at all the other groups, we're in a unique position because it's easy to understand why our stuff matters, you know, on an individual, on a group level, on a scientific level. And so, you know, I think taking on the older child role, even though there's a lot of fun technology and the like, really does make a difference. So thanks.
Al, Jack, just echoing everybody else, you two have done an amazing job. This is not an easy task, seriously. And then you can see even by the comments from Dave Amberg and Shadi and everybody else, you've done an amazing job. So I personally,
it's been great working with you all. I hope we could continue it even after this episode is over, because it's really a pattern for, I think, success in the SUNY system. So thanks much.
Thank
Okay.
you.
Thank you.
Bye-bye.
Have a great week.
Bye.